Whately.
Thank you, Mr. Deputy Speaker.
Yeah.
May I take this opportunity to welcome the new ministerial team to their places and also to welcome the Shadow Secretary of State. But can I request of her a more constructive debate in future on healthcare and not to talk about cuts when she knows perfectly well that this government is putting an extra 10 billion a year into the NHS by 2020. That is not a cut, that is 10 billion extra of taxpayers' money. So please can she not mislead people by talking about cuts? And as also she well knows, her party did not commit to spending anything like that on the NHS.
Can I just say, I don't think a non-rule member will try and mislead another. It's not a word we would use. Come on.
Apologies, I did not mean to use that word, though perhaps she could clarify when she referred to the question of the 22 billion shortfall that was set out in the 5-year forward view analysis, whether her party is now planning to make up that, and if so, where they're going to find the money from, because that was not entirely clear in her comments. But I will move on, because I sincerely believe we need a far more constructive debate about the very real challenges the NHS faces and how to improve the care it provides to our constituents. Because the NHS is under pressure. No one here is denying that. I know as well as anyone. My grandmother spent 5 of the last 6 months of her life recently in hospital, and if the system had been better, she would not have been there and she would have had a much better end to her life. We know that people are living longer with multiple conditions. Around 70% of NHS spending goes on long-term conditions. The treatments available are vastly wider and therefore more expensive than they were in the past. And patients expect far more of the NHS. The NHS should not constantly be criticised, as is so often the case. It is seriously rising to the challenge, performing thousands more operations, thousands more patients being seen every day. And in addition, in response to mid-staffs and other incidents like that, there are also tens of thousands more doctors and nurses working in the NHS. And skilled staff don't come overnight. Training takes years, so there's a lot being done to also address the pressures on the NHS workforce, and none of this should be overlooked, though it is also costly. So can I ask us all to focus on talking about how the NHS rises to the challenges it faces, and as well making sure that it does so in a financially sustainable way. However, to do that, we don't have a blank sheet of paper. There was a 5-year forward view published in 2014. I have previously asked questions, Mr. Deputy Speaker, as you may well know, about what was happening to drive forward the 5 years forward view at the pace and scale that was needed. And the STP is a vital part of the process. These STP plans across the country are about putting that 5-year forward view into practice. And they're doing so in a really important way, looking at the place, at the whole population, bringing together diversity of organisations across the NHS and with local authorities, organisations that are often, in fact rarely, in the same room. I know in Kent there are organisations that have come together that have literally not spoken together, chief executives not been in the same room together. So this is really, really important. It's putting public health at the core of the future plans for health and care across the region, and looking not just at treatment, but yes, how the population can be healthier and how we can reduce health inequalities. So the final thing I'll say is, can I urge all colleagues to do as I am trying to do and make sure that the STP in your areas rises to the challenges and delivers the care that we all want for our patients in future.
Peter Dow.